Hey y'all, so really quickly, I'm in here working on customizing this material for one of my review students, one of my one-on-one students, and we were in discussion about a few things, and I felt like it would be beneficial for you guys as well. And the three things that, and I know it's going to sound simple, but if you don't know what to study, how to study, and how to apply it, that's where you're going to fall short each time. And I say this from a perspective because I was you, right? I was a student who did well in school, but I also am aware of how things are delivered to us, right? So we receive so much material and you're going through it and you're studying it, but you're not grasping things specifically to a format that will be for boards because you're looking at the generalized picture versus narrowing it down effectively. And so that's why I'm big on first identifying what you need to study. And when I was working on these things to even identify what to study, I had to do it for myself because I did the same thing. I did all the reviews, I was prepared, I felt like I knew the information. And you know, my story, I was unsuccessful on my first attempt by 5 points. I couldn't understand what was wrong because I can tell you this stuff backwards and forwards. That's how I'm able to teach so well because I had to do this stuff for me. This is where the mnemonics come from because I had to do it for me. But I remember praying, like, God, if you just show me what I need to do, I don't have a problem doing it. It's just like I'm going through all of the steps and I don't know what to do differently. So I had to find the answers for myself. So not only doing multiple reviews, but I started going to the source, which is the boards, right? And they put the information out there. So even when I'm delivering these things to you, when I design my review books and things in my courses, that's what it's coming from. It's not just me telling you what my opinion is, so to speak. It's research, it's the data, it's the facts of what they're testing you on, so you know what to study. So while you are preparing, go look at those blueprints. Go look at the time frames that are set on there so you know what guidelines to review and prepare for. You have to know what to study. If you don't know what to study, you're just out here randomly shooting shots and wondering why you're missing, right? You're doing it with your eyes closed. So go out here and use the tools that they're giving you. Know what to study, okay? I'm big on you knowing what to study. Also, that's why I break my things down. It might seem short and sweet, but I have gone through the material and I have you focusing on what you really need to study, right? And my thing on that is, y'all, boards are designed to test you on the most common diagnoses and things that you will encounter in practice. They can't test you on everything. They're not expecting you to know everything. They know you are an entry level provider. Now, not to say that we don't move in excellence just because we are at entry level, but that's what they're approaching you from. They're gauging your knowledge on the most common things that you're going to encounter on an entry level. So you have to know those things that are commonly seen in practice, right? You know those diagnoses. You can look at me right now, and if I stopped and asked you, you can rattle off the things that you commonly see. Because one thing that's so beneficial for us also as nurse practitioners and providers from this perspective is that we do have a medical background as nurses. You know those common things. That's what they want to test you on. They want to be sure that if you were to start working tomorrow, you would be able to manage, identify, diagnose, evaluate, and treat those things that will commonly walk through your door as soon as you started, right? So that's what they're gauging. They're trying to make sure that you are ready from that perspective. That's what to study. You're going to study those common things. You're going to go look at those resources that are provided to you that tells you specifically what they're assessing. Because if you don't know what to study, how are you preparing? Are you going to keep doing the same thing? You're going to just do a generalized review, and those outliers is where your deficits will lie, right? Also, now that you know what to study, you have to know how to study. Because still, if you study in a generalized overall viewpoint, like you probably did in school because there's so much stuff being thrown at you, then you're going to miss those gaps when questions are more specific, or if questions are delivered to you in a different fashion. Meaning, if you listen to any of my videos, listen to any of the practice question videos or anything, or have done any of my courses, y'all know I stress assessment, diagnosis, evaluation, and treatment. I stress it over and over and over and over again, right? Why? Because that's how they test you. That's how we practice. That's how we document, right? Your soap notes, that's how we document. When you walk into a room or a patient comes into wherever you're working, that's the rundown. Even though we do a lot of it second nature, that's the rundown. You immediately start assessing people, right? You assess to be able to determine the diagnoses or differential diagnoses. You do the evaluations to see if things are working, or if you need to proceed differently, or if you need to approach the plan differently. And then you come up with a treatment, right? Assessment, diagnosis, evaluation, and treatment. So knowing what to study, those common diagnoses, following the blueprint, and then applying it in that fashion, not just studying and saying, all right, pneumonia, I treat with the macrolide. Yeah, that's good. But if they give you more specifics, how do you know how to navigate that, right? So you need to go through and say signs and symptoms so that you can assess them. How do they present, right? What is that chief complaint? What is noted on exam assessment, right? Then you're able to come up with your differential diagnoses and what diagnostic exams are you doing? Are you doing your chest x-ray? What do you see on that chest x-ray to confirm your differential diagnoses, right? What are you evaluating? Aren't you asking if they've been on antibiotics in the last 30 days? Aren't you asking if they're allergic to anything so that you can know how to proceed with your plan? And then treatment, how do you treat? If you move through each one of those things in that fashion, you're going to get those questions correct, because I don't care how they direct the question, you're able to pivot in any direction, because now you're not just studying in general, you're studying specifically and effectively, right? So again, number one, knowing what to study. Number two, knowing how to study. Number three, knowing how to apply it. And that's why I'm big on reading the stem of the question first, looking to see what they're truly asking you, and then taking that knowledge that you have now effectively studied and applying it. And so what do I mean by that? If you watch any of my videos on my practice questions, you know I always talk about those, reading the stem. If they're asking for a diagnosis, run it back and look at this. Y'all know I say it all the time. And I say this because that's how you have to approach it. And I was doing a one-on-one session. I was trying to explain why I say think of the stem of the question first. Because you get this fluffy scenario and you're reading through it and you're creating your own storyline, because naturally that's what we do, because we have worked, we're medical, we're nurses before we're even the providers. So we're already processing what you're saying. And sometimes that directs you down a path opposite from what they're even asking you, right? So you want to first go ahead and see what the question is. So I always like to give my students these examples. Like if somebody came up to you and said, hey, I want to know if I should continue to take my blood pressure medicine. That's the stem of the question, right? That's the question itself. Should I take my blood pressure medicine? And then they go on to tell you this lengthy story about, oh yeah, I was taking my kids out. I tripped, I skinned my knee. It's been bleeding. It's not healing really well. Look at it. Doesn't it look bad? Yeah, you note that it does look bad. Blood sugars are good. Blood pressure was 80 over 64. They've been feeling dizzy lately, and they're giving you all of these things. Now, granted, yes, you need to pay attention to the knee. Yes, that scrape on their knee may need some care, wound care, or adjustment, or watching, or whatever else. But that wasn't the question. The question was, do I need to continue taking my blood pressure medicine? Blood pressure is 80s over 60s. We need to hold it and figure out why, right? But to answer the question this way, because that stem, the statement, you knew what the question was, right? So we're not worried about all the extra outliers, because that's not the question they asked you. That's what the stem serves as. What are they asking you? What are you addressing right here? Because so many times what I find that you do, and that I used to do, we start to create our stories. Now you're answering, oh, they need wound care. I would apply this. I would apply that. Now you go into the answer choices, and now you're sitting here like, wait a minute. And you're mixing yourself up because you have created your own storyline. So I say all this to say, again, make sure you know what to study, make sure you know how to study, and make sure you know how to apply it. And again, I say this from a space of me personally having to figure out how to approach this differently. And so, what I did for myself to go from unsuccessful to successful 10 years ago is what I have continuously helped others to do, thousands of now nurse practitioners. And so, that's what I am stressing to you guys, that even as you work through this stuff and navigate, I don't want to make this harder. Let my struggles help you be successful. I'm trying to tell you the game. Tell you, like I tell my daughters, like, I can't do anything but give you the game. Now, if you choose to use it, that's up to you. But I'm giving it to you so you don't have to struggle. So again, take those steps. Do the things you need to do. Use the tools that are out here for you. Don't work backwards. Smarter, not harder, right? So if they have the blueprint out here, it's for a reason. Number one, being able to understand it. If you have questions, ask. I'm happy to explain what that means. But look at the blueprint so that you know how to approach this test. Start to study effectively and do those practice questions. Practice the things so that you're conditioning your muscle memory so that your application increases, right? You can see your improvement. You can see where the areas that you may have been weak in, that they will begin to improve. And you just repeat this thing. You just keep doing that same cycle. And then you go and you'll be successful on boards. Now, I know that's just the quick 3 little areas that we talk about. And I'll probably do more because I get a lot of questions. And I've been saying I'm going to get around to explaining little things that I commonly hear from you guys. But I just wanted to say that when we were just talking and working through her plan, that was something that we were talking about. So I wanted to make sure to share it with y'all too. All right, y'all. Talk to y'all later. Bye.